Hello, I am Dr. Paresh Varty. I am a gastrointestinal surgeon at the Lilavati Hospital Mumbai. I am going to talk on insights into colon and rectal cancers. Cancers of the colon, that is the large intestine, and that of the rectum, which is the terminal most part of the large intestine, are indeed very common. In fact, they rank as the third commonest cancers worldwide. More than 40 lakh people are newly diagnosed every year globally, thereby realizing that it is an enormous burden on the healthcare. These cancers have now been treated by effective modalities and the outcomes have improved significantly. Basically, there are certain risk factors to which some people are predisposed to tendency of developing such cancers. Those people who develop polyps, these are outgrowths from the lining of the large intestine. Those people who have a genetic background, that means their family members have already suffered a cancer. Those people who have inflammatory bowel disease, those people are old, and those people who are obese generally have a higher tendency of developing such cancers. Such people with this history should indeed be cautious and therefore undergo a screening colonoscopy. There are few common symptoms and signs of colon and rectal cancers, and the most important one being bleeding through the stools, which can happen, and also sometimes black colored stools. There might be a history of change of bowel habit, there where the patient will develop progressive constipation and also followed by diarrhea. Over and above that, the patient tends to become anemic, weak, tired, and over and above sometimes they develop pain in abdomen as well as some mass in the abdomen in the late stages. Now, therefore, we have to resort to certain investigations to do the diagnosis on time. These investigations include our routine blood and stool tests. They also include, and the most important ones being the colonoscopy, which is nothing but an endoscopic examination of the large intestine from the rectum up to the small bowel. These colonoscopies achieves the diagnosis as well as takes a biopsy, and therefore the diagnosis is accurately confirmed. Once the biopsy is achieved, these patients need a series of advanced imaging tests which include a CT scan, MRI scan or a PET scan. Based on these investigations, the stage of the disease is identified and appropriate treatment is chosen. Newer molecular tests which do at the tissue level have also improved our understanding biologically of these cancers and therefore allowed us newer therapies. Once the diagnosis and the staging is achieved, the patient needs to be managed by several modalities. Surgery becomes the most important treatment in such patients, and those cases which can be offered surgery have a higher chance of better survival.